afternoon, everyone. My name is Irene from Infection Control Department. Would like to welcome you on my live stream discussion for today. And my topics for today's discussions regarding MRSA, methicillin resistant Staphylococcus aureus, and antibiotics. And today I would like to inform you that my webinar participants who will be with me today is Dr. Sana from the head of the laboratory. And this is about antibiotics and MRSA. Okay, I just prepare it. Let's start. Okay, I'll start now for the topics of MRSA. What is MRSA? This is your methicillin resistance Staphylococcus aureus. By the way, I just inform everyone that every week we have a lecture for this from Infection Control Department. And let's start. Be the change you're trying to create by Mahatma Gandhi. Okay, the definition. Methicillin resistant Staphylococcus aureus refers to strains of Staphylococcus aureus that are resistant to synthetic penicillin, such as oxacillin, ofloxacin, and methicillin. And it is also resistant to cephalosporin, other beta-lactam antibiotics, and sometimes to other antibiotics such as erythromycin, clindamycin, aminoglycosides, and what? Quinolones. Also related to the potential for healthcare associated infections, transmissions, and the limited number of antibiotics available to treat infections caused by these microorganisms. Okay, that's our definition. MRSA is a methicillin resistant Staphylococcus aureus, a type of staph bacteria that is resistant to many antibiotics. And then in a healthcare setting, MRSs can cause problems such as bloodstream infections. And who is at risk? Primarily spread through direct and indirect contact with infected or colonized patients. Poor adherence to standard precautions can lead to transmissions between patients. Adherence to infection control measures is critical to preventing MRSA outbreaks. Who are more likely to get an MRSA infection are people who have other health conditions making them sick, have been in the hospital or a nursing home, and then have been treated with antibiotics. Okay. How does someone know if MRSA is the cause of an infection? The only way to know if methicillin resistant Staphylococcus aureus is the cause of an infection is to perform a laboratory culture of the bacteria. Might test some patients to see if they have MRSA on their skin. This test involves rubbing cotton tip swab in the patient's nostril or in the skin. Can I have question? Can MRSA infections be prevented? What's your answer? Yes or no? Yes. Clean their hands with soap and water or an alcohol-based hand rub before and after caring for every patient. Carefully clean hospital rooms and medical equipment. Use contact precautions when caring for patients with methicillin resistant Staphylococcus aureus. Contact precautions. How? Huh? Yes. Clean their hands with soap and water on an alcohol-based hand rub before and after caring for every patient. Carefully clean hospital rooms and medical equipment. Use contact precaution when caring for patients with MRS. Contact precautions. Ensure under contact precautions. And then healthcare workers caring for patients must affix the green code. What's this? The contact precautions. This is the one we did in our facility. You must put on signage that the contact precautions is in green code. And then they follow the steps of how to use the PPE. Sign in the door. The purpose of MRSA policy: identify sources of MRSA if possible, prevent the spread of MRSA, then the scoop, the infection control team, the infection control committee, the clinicians, the nursing staff, the microbiology lab, and the housekeeping staff. Policy: screen all high-risk patients with culture of colonized and infection sites upon admissions. High-risk patients may include those with previous hospital admissions or referral from other hospitals. The history of nursing home residents aged of 75 years or older, then dwelling devices, underlying diseases or severe illnesses. Follow the pre-operative screening for MRSA is recommended in elective major surgeries, orthopedic surgery, oral surgery, and cardiothoracic surgery. The antibiotics shall be used appropriately by following the antibiotics policy in order to decrease the antibiotic burden in the hospital. It refers to pharmacy antibiotics, antibiotics sensitivity surveillance policy, and recommendations for vancomycin used in the healthcare setting. This vancomycin we topic last week before during our discussion in our care bundles and surveillance. For clinicians, request isolation if found culture positive for MRSA during a previous admissions. A private room is required. If this is not feasible, placing two or more MRSA patients together in the same room, what you call is cohorting. Patient together with the same case definition, MRSA is recommended. Shall request from screening of all high-risk patients as directed in the previous point. Place the patient in a private room in isolation. Inform the patient who are found to be colonized or infected with MRSA of what this means. Provide follow-up care for all colonized and or infected patients and staff. This continuing contact observations. The patient must be off all antibiotics for 72 hours before cultures are taken. Screening swabs and previously positive sites in colonized affected patients shall be taken with you. The patient's test result must be negative on 3 consecutive occasions before being considered clear of the infection. If necessary, screening swabs can be taken every 2 days instead of weekly. And thank you. And the next will be discussed by Dr. Sana. And he will be with us today for the next topic, which is your antibiotics uh, policy. Hello, Doctora. Are you there?
Mm, Good afternoon. Uh, are you hear me well?
Yes, I hear you, Doctora. I hear you clearly. Go ahead, Doctora. We will be
Uh,
discussing topics of antibiotics. And it will,
okay, thank you to give me again this chance
mhm.
to participate in this webinar. I will
Mhm.
talk, inshallah, about antibiotic policy.
Okay,
Can you share
start.
the screen, please?
Yes. I will share the. This is your antibiotics, Doctora. Hello?
Yes, antibiotic
You
policy.
hear me? Okay, let's
Yes,
start. This is
hear you
okay.
well.
Start. You can speak, Doctora, for a while. You can speak English, Arabic, no problem.
Okay, can you share the screen, Irene, please?
It's
Share
already.
this.
Yes.
Are you share the screen?
Yes, Doctora. It's already in the screen, Doctora.
Okay.
Yes.
Uh,
Your
First,
sounds. Maybe you have.
yes, we can define the antibiotic as
I
a
hear you. I
substance,
hear you, Doctora.
yes, substance produced during the growth of microorganisms which, in low concentrations, destroy or inhibit the growth of other species of microorganisms. This is the definition of antibiotic briefly. المضادات الحيوية تعريفها هي مواد بتنتج بكميات بسيطة عن طريق الأحياء الدقيقة عشان دستروي تهدم لنا أو تثبط لنا النمو بتاع المايكرو أورجانيزم.
كميات بسيطة عن طريق الأحياء الدقيقة عشان
The antibiotic
تستروي
policy
تهدم لنا أو
is the
تثبط
definition
لنا
of antibiotic policy is the set of strategies and activities undertaken to organize the antimicrobial treatment in the hospital and achieve health outcomes for patients. يعني هي مجموعة من الاستراتيجيات احنا بي organized بنعملها في الانتيميكروبيال تريتمنت لمعالجة الميكروبات في المستشفى and achieve a health outcome for patients. طيب aim of antibiotic policy لماذا أنا بعمل الانتيبيوتيك بوليسي السياسة بتاعت الانتيبيوتيك. طيب to decrease morbidity and mortality due to antimicrobial resistant infection is the first aim. Second aim preserve the
to
effectiveness
decrease
of antimicrobial
mortality
agents
and
in
mortality
infection.
due to
Number
antimicrobial
3,
infection.
prevention of
Maternal care,
communicable
antibiotic at
diseases.
home, preserve the effectiveness of
Okay, this is the aim of antibiotic policy briefly. By the other word, we use the antibiotic policy to improve the patient care by promoting the best practice in antibiotic prophylaxis and therapy, make better use of resources by using cheaper drugs where possible, retard the emergence and spread of multiple antibiotic resistant bacteria, improve education of junior doctors by providing guidelines for appropriate therapy, eliminate the use of unnecessary or ineffective antibiotics, and restrict the use of expensive or unnecessary powerful ones.
powerful ones. Next.
باختصار
Yeah, the scope.
احنا الانتيبيوتيك بوليسي هي مهمة عشان لما انا احسن الانتيبيوتيك وانظم التريتمنت واعمل افويدنس للانيوس وعمل فوكسنج لليوسز انتيبيوتيك كده انا بقوم avoid the resistance of bacteria. Resistant of bacteria that means the bacteria that can resist the antibiotic, not response or cannot be inhibited by the antibiotic. يعني تكون مقاومة للمضادات الحيوية. الاستخدام من غير سياسة للمضادات الحيوية بيؤدي لنا إلى أنه البكتيريا تبقى مقاومة للأنتيبيوتيك للمضادات الحيوية. Scope organizational structure of antibiotic policy must be participated by all this in the hospital by
Yes.
clinicians,
Mm-hmm.
microbiologists, pharmacists, nurses, antibiotic committee, and infection control committee. All this must be participated in the organization and structure of antibiotic policy. The policy of antibiotic. Before initial dose of antibiotic is given, suitable specimen should be taken for culture and sensitivity. Antibiotics are prescribed usually only when the results of culture and sensitivity are already available. First, what if the
Yes.
antibiotic or the results of the sensitivity culture of sensitivity are not done? Okay. The second
Okay.
one, cation prolonged use of broad spectrum antibiotic may cause bacteria fungal overgrowth resulting to secondary infection. Prolonged use of broad spectrum must be avoided. In case of using empirical antibiotic, it must be cheap, fairly elective, and will not interfere with the treatment of the patient when the actual causative organism identified. Responsibilities. Antimicrobial formulary is a document that changes with time. formula of antibiotics لازم تتغير with the time. ليه؟ لأنه البكتيريا بيحصل لها تغيير change وبيحصل لها mutation due to الميوتيشن لأن هي بتحصل لها أفراد جينية بتتغير فالفورميولا must be of antibiotic must be changed. منو اللي بغيرها؟ responsibility. Number one هم الفارماسي and therapeutic committee will review the policy when necessary to add new drug and delete old ones which are no longer used. Pharmacy staff will dispense medication according to policy guidelines. Microbiology department will guide the pharmacy and therapeutic committee regarding better of resistance to antimicrobial cause inflammation and cause infection. antimicrobial policy will be reviewed on this recommendation because the microbiology department قسم الأحياء الدقيقة يقوم بزراعة والقيام بالحساسية للأنتيبيوتيك، وهو ممكن يعمل give a list of antibiotics that resist a most common bacteria. All this helps the pharmacy staff and the committee of pharmacy and therapeutic drugs to make the decision and make the policy. And according to the microbiology department, this committee can change according to the result of the microbiology department result. The medical director will advise all medical staff of the importance of adherence to this policy. Choose of suitable antibiotic therapy. Before selecting antimicrobial, the physician must first consider two factors. في عاملين مهمين قبل اختيار الانتيبيوتيك. طيب, the patient, the first one, and the second, duration of therapy, doses, and route of administration. The patient must be care about or take on consider the history of allergy, renal and hepatic function, resistance to infection, ability to tolerate drugs by mouth, severity of illness, age, weight, if female, whether pregnant, breastfeeding, or taking oral contraceptives. Second, duration of the therapy, dosage, and route of administration depending on side of infection, nature of infection, severity of infection, and response to treatment. Good microbiology, early next slide, next slide, please.
Yes,
Erlene,
Doktora, go ahead.
next
Yes, Doktora,
slide.
I'm here listening to you. Go ahead.
Yes, yes. Click next
But
slide. Yes.
yeah, there is some
Next,
beside your.
next also. Next also. This is the department of microbiology. Good microbiology practice will save the resources and reduce the antibiotic
The
usage.
antibiotic usage.
Yes, because
And
also hand
washing.
washing is important before before uh, before the
Eating.
practice and after the microbiology practice, before and after. Hand washing is very important because hand hygiene compliance rate of 10 to 40% has been observed in developed countries, and it is minimize the infection. Hand washing minimize the infection.
Yes.
uh, if the infection is minimized, also we minimize the use of antibiotics. Thank you, Erling.
Yes, Doktora. Yes, Doktora, I hear you. Yeah. Do you need something to add or like
Yes, if there is any question about antibiotic policy in the hospital, especially.
yeah? Is there any questions from your staff there? And regarding other wait, before I had some regarding our by the way our antibiogram. Uh, how did you do the tabulation for it? Can you explain for us?
Yes,
Like,
we start in the microbiology department. Appoint an infection control officer in the lab, and we start to collect the data in 2020 about the culture and all the result of the sensitivity and the main gram positive and the number of gram positive and gram negative
Mm-hmm.
bacteria and collect what is the main bacteria in the hospital
Mm-hmm.
like Klebsiella, um, Staph aureus, Enterobacteriaceae. It is Pseudomonas. It is the main these main bacteria found in 2020. But we not complete all of the data because 2020 large amount data about the results of the sensitivity and culture. And soon we finish, inshallah.
Okay. Because by next week we will have committee for the antibiotic one for it because it's been last the week ago that we already discussed this, but we need to follow up regarding the result of this and I will inform you regarding the committee that discuss for we will discuss for us. Okay, Doctora? Do you have another something to add or questions for the lecture for today? Or, and okay, Doctora, thank you for the participation for this lecture
Thank
today.
you
And
also for you.
yes, and hoping and next week we will have another discussion for your side's concerns regarding your department.
Thank you
Thank you, Doctora. Thank you.
for this good organization, Erling. Thank you so
Yeah,
much.
yes, and we will continue this. And also, and by the way, maybe on Thursdays is for the nurses.
Bye.
Okay, thank you, Doctora. See you. Okay, for our discussion today is regarding MRSA and antibiotics that we discussed with Doctora Sana. And I would like to thank her for being in the participation which she is with us today. Okay, I would like to welcome our quality secretary. She is in the box stage now. Um, she started again here in our facility last week. Hello, Miss Teresa from the quality department. Do you need welcome to our live stream discussion topics for today? I would like to address your attention for discussion
Thank
today. Is there anything to add or questions for us?
for now it's okay and a successful one. Thank you for the effort, Miss Irene. It really adds in our organization to have like this for the Sivahe, for the requirements as per standard. Nice job.
Okay,
In
thank
behalf
you.
of Dr. Ahmad Ramadan,
Yes. And thank you for the participation. And we will
you're
continue
always
this.
welcome. Inshallah.
And inshallah, we will continue this.
Good
It
luck,
will
sister.
be, thank you. We'll continue this topic on the next. No, I have scheduled for the nurses on Thursday, and it will be continued. Another group of participants will come out and appear to be with us. And for the topics we'll discuss is regarding the aseptic technique. And thank you for this time, and I will come back.
Hello.
Yes.
Someone decompose. Finish?
And thank you for the participation to all of you. Thank you much, and see you on the next topic this week.